Hey guys, what's up? This is Akshay, and welcome to the first episode of the Akshay GP Show. And we have a very special guest with me here today. She's my personal therapist, and it's been a year since I've known her. I believe in this fact. You people, you meet right people at the right time, and that's what happened with me last year. We have Sanjana ma'am here.
Hey Akshay,
How are you, ma'am?
I am good. How are you?
It's a pleasure to have you on the show.
Thank
It's
you
been
so
like a
much.
first episode. It feels great to have you here.
Thank you so much.
Great. Can you please introduce yourself?
So, I'm Dr. Sanjana, and I'm a consultant psychiatrist at a medical college in Bangalore. I have done my MBBS and MD from Rajiv Gandhi University of Health Sciences, and I think it's been 2 years of experience now. I believe in both therapy as well as medications, as in a holistic approach to psychiatry rather than just medications.
Great, great, great. So, I have a lot of questions to ask you today about this, very important topic, I would say. It's
Right.
something that's, I think it's very much controversial topic, very much, stigma, you would say, I can say, I guess.
Yeah,
And especially in your field, you must have faced a lot, right?
right.
So, can you just explain me what exactly is mental health?
So I think that's like a really vague first question. Yeah, so rather than like knowing what mental health is, I think you could start with how this question itself tells you how much we are behind on the whole part of mental
Exactly.
health, right? Like you never ask what physical health is, but you always like go with what is mental health. There are a lot of definitions for it, but what I would go by is that mental health is when you are able to do your routine activities in the right productivity and capability that you can without harming yourself, without stressing yourself way too much, and without or with nurturing yourself at the best.
Hmm. Great, great, great. So, in your experiences about this entire experience of starting therapy and all, and how difficult it was for you to start, and how much like you would have seen different kinds of people who face different kinds of mental health. What's this? Can you just explain what's the common kind of symptom when you see these people? Maybe it may be anxiety, it may be depression.
Most of the cases or most of the clients that come to me are usually they come to me with sleep disturbances,
Hmm.
appetite disturbances, some issues with their appetite. I do get a lot of clients who say that there is loss of productivity, there is loss of
Hmm.
concentration at work or studies, depending on what their occupation is. Uh, Low self-esteem is something that I've been coming across a lot nowadays,
Hmm.
right? And pretty sensitive to criticism. That is also
Hmm.
something that I've been seeing a lot in an age group of, let's say, 18 to 25 to 30.
Hmm.
I also get a lot of cases with panic attacks,
Hmm.
anxiety related issues, low
Hmm.
mood, sadness, crying episodes, etc.
Okay. So most of these people, I think I would say most of these people are like students who are studying, who, like I would say youth kind of people.
Yeah, I mean, I think we are now fortunately more oriented towards therapy, unlike
Hmm.
before. They are open to it and they are at least willing to try it out than before because I have seen my professors and my super seniors saying how not everybody has that mindset to go to therapy, right?
Hmm.
That's the reason why even now I think therapy is a very stigmatized thing in India as of now. The minute you say therapy, everybody thinks that it's just like, बस बैठना है, बातें करना है, और कुछ नहीं है, कोई सुनाएगा तुम सुनो. But
Hmm.
I think you very well know that that is not how it works, right?
Hmm. Yeah.
So, at least now, I think that's one good side of social media that we know how good therapy is and how much it works. So I like how everybody is now at least willing to try out a session or they think about therapy in a positive sense.
Hmm.
Yeah.
Great.
So if I could ask the podcaster a question, if that's
Yeah,
okay.
yeah, yeah, yeah. Sure.
Why did you get into the whole, topic of mental health? And other than the point that you have come, you have come a very long way. Like I said,
Hmm.
like since a year, I've seen like enormous change in you. But why mental health, especially? There are so many other things you could have focused on. What made you um, take up a topic of mental health and going about destigmatizing it or increase its awareness?
Ma'am, to be honest, I have faced a lot of mental health issues, and I didn't realize it when I got introduced. I thought something is wrong with me. And when, the good side of internet is that, when you get exposed to good content, and I had a lot of anxiety episodes
Mm-hmm.
till I stopped going to school because of it. I had a huge years of social anxiety. I never left my room, and I was very insecure about myself. I was like 120 kgs something.
Oh, okay.
Yeah, I was very afraid of people judging me and all that things. So I stopped going to school only because of that. And when I entered my college also, people were like far ahead of what used to see in my age group.
Mm-hmm.
I used to see people riding bikes and all. I can't do that. It used to feel very bad. And last year and all that, still try to figure it out, very unorthodox way, I guess. And there are some outcomes of you know following these kind of you know falling into the bad company. Somehow you figure it out, man, this is how I'm going to face it, this is how you're going to face it. And I got confidence through doing things which I was very scared of. But when things got very bad, I think when I met you,
Yeah.
uh, I think because I have this one friend who said to me, you should try therapy. And I used to tell about her, my friend. She was like, you should try therapy, you should try therapy. And I was like, what is this all about? And she made me like open the website where she booked an online session for me. And I thought this entire thing is just useless because I have a very bad. Before meeting you, I tried like 2 to 3 therapists, and I remember one therapist. She was like telling me about everything. The whole entire session, it was all about eating oranges and why it's important to eat oranges because it has vitamin C. And she was like, it reduces anxiety and all that thing. I thought, I'm not talking to a nutritionist here. It was
Right.
very, very weird. Like I thought it's not my cup of tea. But
Mm.
I remember my senior in school, Vaishnavi. She's a good friend of mine. She told me, texted me. I used to share about her, about all my troubles of my life. Once, like while she used to come online and all that. She told me like my sister, she just graduated and she's starting therapy. And she's gonna do it for free for you. I'm like, okay, great. Let's try it out. So that's how I met you, I guess.
Yeah.
Yeah, my life has improved a lot, and I feel there are a lot of youngsters I personally see struggling a lot every single day, and they don't
Right.
open it because you have seen how there's a lot of difference in me from last
Right.
year, isn't it? You have
Totally.
changed my the way I view my life in a very different way now. I think my thought process has changed. I
Yeah.
see things very differently. I understand things very differently. I think it's all because of therapy, to be
Agreed.
honest. So I think that's the exact reason why I chose this topic. Yeah. Okay, so there are like some of the important questions which
Mm-hmm.
is related to a lot of mental health awareness, mental health things. Okay, um, the first question, which is very common, is uh, the difference between psychiatrist and a psychologist in the context of mental health kind of thing. Because when it comes to mental illness, particularly, people think they're going to give you medicines and something is wrong, and they're going to tell you something is wrong with your brain, and people take it very personally. मेरा दिमाग ठीक नहीं है क्या क्या होगा मुझे and all that. For me, it was very different.
Right.
You didn't tell me something is wrong with your brain and all that. I was on medications, but you told me that. why am I giving you medications and all that thing? And is this when you take therapy,
Mm-hmm.
and why should we consider the fact that if this person is a psychologist or psychiatrist, and how much difference does it make?
So to begin with, a psychiatrist is a person she's basically he or she has graduated with MBBS degree and then does a specialty in MD psychiatry or
Hmm.
diploma in MD psychiatry. I mean diploma in psychiatry, right? So they're basically doctors and they can prescribe medications to you in in a simpler way. They can provide therapy as well as they can prescribe you medication. So, to put it in our technical terms, so it is both pharmacological as well as non-pharmacological treatments. Both can be accessed. While a psychologist is a person who has done a degree and master's in the subject of psychology. So
Hmm.
it could be, it's basically humanities and I mean, even psychologists have various divisions in them. So there are clinical psychologists, there are educational psychologists, there are occupational psychologists. The other part which nobody tells is counselors. Now, counselors are completely different. A counselor and a therapist are two different things. Okay, so I have seen, I mean, a little off the topic is that I've seen a lot of people even on Instagram coming up with how they write that let's take away depression in 7 days or a
Hmm.
workshop on anxiety to उसको 10 दिन में मिटा देते हैं, which is not the right way to go through. So those are basically counselors who would have done a small short course on things. I mean, nothing personal, but uh, they are not certified mental health professionals. Now, mental health professionals are either psychiatrists or psychologists, especially
Okay.
clinical psychologists. So, when you're
Hmm.
considering therapy, you could contact a psychiatrist or a clinical psychologist or a counseling psychologist, the one who has done a course in clinical subject, as in the one dealing with human behavior, especially
Hmm.
and the disorders that are known to, that are being treated by the psychiatrists. So
Hmm.
the major difference when it comes to treatment is that major illnesses other than anxiety and depression, like schizophrenia, substance abuse, right, like nicotine or alcohol, they're all normally treated by a psychiatrist, which needs medications, while a psychologist helps in assessment of these disorders that I just told you, and therapeutic treatment and a non-pharmacological treatment.
Great.
Yeah.
Uh, in this context, I want to ask you one basic, simple question. I think this might raise in a lot of people's mind is, when do we know we're depressed and when do we know we're just sad?
Okay. That's like a very, very good question. It's not a basic, simple question. I think it's a very proper question because you see that a lot of people just very loosely use the term, dude, I'm so depressed today.
Yeah,
Right, very
exactly.
loosely they use it. Rather than like, I'm so anxious. My entire day was depressing. The movie was depressing, etc.
Hmm.
But I don't think you should be using that word so often and so loosely because it takes away the validation from the major depressive disorder that is that, right? So depression basically is a diagnosis or depressive symptoms are a set of symptoms wherein there is low mood, sadness, crying episodes, pessimistic thoughts about future, etc. for a period of about 2 weeks, and it is present at the most time of the day and it interrupts with the socio-occupational life of the patient, of the person, right? That means that if you are a student and you go to the class, your concentration is lost. You do not sleep properly, you do not eat properly, and you're not able to sometimes even attend college.
Hmm.
Right. While sadness is something that is appropriate to the situation, like for example, you see a pup and you see that it's limping and you feel sad about it, or you get your exam marks and they're not really good and you feel sad about it. So, sadness is something that it's an emotion that comes which is appropriate to that particular situation.
Hmm.
Yeah, and it is not persistent, right? Like while depression is persistent, it's present at 75 to 80% of the day. And it's
Hmm.
there irrespective of whatever situation is happening around you. Let's
Okay.
say you're in a party and you
Hmm.
don't really feel that happiness that you used to get before, or you feel that pleasure that you used to get before.
Hmm.
That goes in terms of depression, while sadness is something that can be changed, like according to the
Hmm.
situation.
Okay. So while we talk about depression, I would say that people get depressed for a particular maybe incident, maybe someone lost someone,
Right.
maybe they're close to their family. There are many different kind of reasons.
Mhm.
Can a person be depressed without any particular reason? Is that possible?
Yes, that's very much possible. So clinically, we see two types of depression. One is called as an exogenous depression, another is called as an endogenous depression. So exogenous depression is when there is a particular reason, or you could find out a particular precipitating factor, right? That something has happened. Let's say some sort of traumatic event has happened, loss of somebody, or any reason for that matter, any trigger, any stressor for that matter preceding which, I mean, preceding the depressive episode that is there. Okay.
Hmm.
While endogenous is wherein there is no factor that is attached to the depressive episode, it normally occurs in thyroid disorders or any other organic
It can be
conditions.
genetically as well.
Yes, and it can be genetic as well. If there is family history of depression or suicide, etc., or any
Hmm.
other mental illness, there is a good chance of endogenous depression that is there. So a lot of times, I do have patients coming to me and asking that there is nothing wrong with my life, nothing happened. Uh, my life was going absolutely well, and now I suddenly don't feel happy at all. So that kind of depression is also present, and it has to be evaluated properly by a psychiatrist.
Okay. Great. Great, ma'am. That was very informative.
Yeah.
Uh, there are a lot of like effects, or maybe because of we are depressed. You know,
Mm.
is anxiety related to depression?
Yeah. So, ang anxiety again is a bigger
Different term.
term. Yeah. So, anxiety
And
symptoms.
because
Huh.
I have this one doubt, because I used to face a lot of social anxiety, and
Mm.
maybe because of that I got depressed. I don't know.
Yeah.
I don't know if I was depressed or not. So maybe because of anxiety, are there any chances the people might get depressed? I don't have any solution for the entire anxiety thing that I'm facing. A lot of panic attacks, a lot of anxiety attacks. You know, maybe this one mental condition can be it related to another. It can develop into another. Is that possible?
Yeah, it is. So, anxiety and depression are two different terms, but
Hmm.
they're sometimes correlated. As in, sometimes there's major depression related with some anxiety symptoms like panic attacks.
Hmm.
But there is also anxiety wherein, for example, let's say the person has social anxiety, like how you told me. Now, the person probably starts going outside and does not feel like going outside, feels very claustrophobic, starts putting himself or herself into the house. They just don't
Hmm.
go outside anywhere and their social life is completely cut off.
Hmm.
That could be the cause of depression that could follow the anxiety.
Hmm.
So it's both ways, or it could be even present together sometimes.
Okay.
Yeah.
Great. Great. Uh, when like there are a lot of people. I kind of did a survey when I was before doing this podcast. I
Mm-hmm.
asked a lot of people, a lot of my friends, about what kind of mental health problems you personally face a lot, and many people told me that 90% of them have anxiety issues.
Mm-hmm.
And that kind of like I was thinking about it, like I thought I'm the only one who face it a lot. Okay. And there are many of the people who face anxiety. And can you tell me what's exact reason due to this? And is because especially in this, I think from last 5 6 years, I if you just take back the time to maybe 8 years or something, I don't think this word even existed in India. Many people didn't know this term now, but it's kind of became kind of like a common. Can you just explain what actually anxiety is? And many people don't realize it. Maybe we're not anxious, maybe we just because we see it in the internet, maybe we just feeding ourselves, "Man, I'm anxious today." Can you
Yeah,
explain
so
about it?
anxiousness is another thing, right? So there is a term called worrying, right? So we
Hmm.
worry for a lot of things. Then there is something called nervousness. Then
Hmm.
comes anxiety or anxiousness. Okay. So these terminologies mainly mean something that is out of proportion. Like, for example, you have to go meet a girl today for a date,
Hmm.
right? So you just don't know which clothes to wear, or what do I wear, how do I dress, where do I take her, or what do I do? Now, when you have constant thoughts about this, it's just worrying, and it is again the same thing appropriate to that particular situation, isn't it?
Hmm.
So I wouldn't call this anxiety. Although now we very loosely use this particular term, ki, dude, I'm so anxious, I don't know where to take her.
Exactly,
But this is
exactly.
just worrying. You're just worried about it. You just are
Hmm.
thinking a little more than usual that okay, I am meeting a girl and I do not know where to take her and what do I do or how do I do it. It's just a chain of thoughts that are a little rapid than usual.
Hmm.
That's it. So it could be just really nervousness, or it could be just a little bit of, worrying, right? Nothing
Hmm.
more than this. And it's not out of proportion because it could be the first time you're taking somebody out on a date. And the minute you take the person out on a date and you completely feel okay with it after you finish doing that particular task.
Hmm.
Now, anxiety is when it is blown out of proportion. You start having tremors. There's, shaking of hands, or there's a lot of sweating that is associated. Palpitations are there. Heart beats really faster. You have problem breathing, and you're not
Hmm.
able to concentrate. You're not able to judge anything. You're not able to do anything at that particular moment. There's a lot of restlessness, inner
Hmm.
restlessness, as well as, outer restlessness. You're not able to sit at a particular
Hmm.
place. Okay, although it just looks like, okay, it's just taking somebody outside. It
Hmm.
really doesn't matter how the outcome of that particular thing is going to be, right? If it goes out of proportion and you actually have an issue when you take her out as well, even then you are anxious, wherein you are not able to still concentrate on what is happening at the best. So not being there at that right, I mean, present moment. You either keep thinking about what has gone wrong in the past, or anxiety is moreover related to what will go wrong
Hmm.
in the future. A lot of thoughts and fear about future. What if I mess this up? What happens if the food comes late? What if there's a cockroach in the food? What if the waiter comes and just like falls on the plate? These are all
Hmm.
thoughts which might not happen and they're pretty much illogical, but they keep happening irrespective of whether you want them or not. While in worrying, they're completely under your control. You're able to control how much of a worry that you can. If you get distracted, you're completely okay. A friend of yours comes and just reassures you, "Dude, nothing's gonna happen, man. Like, just take her outside."
Hmm.
While in anxiety, that's not the case. Even any sort of reassurance might not work. And I think you did face this, wherein a lot of reassurance also was not working much,
Hmm.
right? So that is where anxiety and worrying draws a line, wherein again, anxiety and depression have one thing in common, or most of the psychiatric illnesses have one thing in common, wherein it disrupts the daily living. Okay, so whatever
Okay.
your productivity is, or whatever your social life or occupational life, you're not able to handle it, or you're not able to go through it smoothly.
Hmm.
I think that would be a better word to use. So if
Okay.
that happens, then it's called anxiety or depression.
Okay. So, what do you think the exact solution to this? Maybe a person who doesn't reach out to a psychiatrist or a therapist or psychologist, anyone who's a mental health professional.
Mhm.
Like what do you think a practical solution to this? People who face it a lot.
Practical solution is to seek help.
Okay, that's great.
Because see, one thing that I would like to tell is that also you will agree with me a lot is that
Hmm.
when a person is anxious or when somebody deals with anxiety disorders, the main core belief that nothing's going to help me.
Hmm.
Everything is gone, it's hopelessness, and you feel like the world is going to come to an end. Okay.
And second,
Raising more,
most important thing that I face a lot when it comes to anxiety is your breathing changes. I don't know
yes,
why I noticed this. It's like you have this psych breathing. You're breathing very fast,
yeah,
rapidly.
yeah.
I think maybe if we try to control that, or maybe try to learn to bring it back to normalcy, maybe that will help also,
Yeah,
if I'm
it
not wrong.
will, but ultimately it's just a short-term solution to it.
Exactly. Hmm.
I mean, it's gonna calm you down. I mean, it's beautiful. And breathing exercises are one of the best things ever. I recommend it a lot. But again, like I said, it's just a very short-term solution to,
Mm.
the anxiety attack that is there. But what exactly is causing anxiety is something that we should focus on in a
Mm.
long-term way. So if it is somebody's validation that makes you anxious, or let's
Mm.
say that you're sensitive to a particular type of criticism, or you're anxious at your workplace because you think you're incapable or there is low self-esteem. So rather than just focusing on that particular time and like just the breathing exercise, it's more important to process or analyze what happens, what are those thoughts which are disturbing you, or what kind of distortions are happening in your thought process which is causing this particular anxiety. So, in a nutshell, what I mean is the root cause of anxiety. So, whatever
Mm.
is the root cause of anxiety, analyzing it, see, that is also something that anybody can do, right? Like you can analyze it, but doing it non-judgmentally.
Mm.
Like, for example, let's say you go for an internship, right? At a place, and it's a very big firm, and you go and you suddenly see that everybody there is someone who's graduated from a really big college or a very big institution, university, etc. And you suddenly feel so low esteemed, and you start feeling so incapable that your productivity just completely comes down. You start making small silly mistakes. You start feeling very nervous in front of the boss, or whatever you want to tell, you don't utter it, you start stammering, etc. Right? So
Mm.
anxious features, or you start having panic attacks over there. Right? Now, here, understanding that it's the feeling of incapability or feeling of low self-esteem is what is causing this particular thing.
Mm.
But if you go tell it to your sister or mom or dad or your friends, and it's like, hey, nothing, this is what happens when you join, yeah, nothing's gonna happen. They completely invalidate it, or they might like judge you that, oh, for such small thing and all, you're feeling like this.
Mm.
Right. I'm very sure you would have like seen this. I myself have faced this when I
I've seen
go tell
it.
somebody this, and I'm like, oh, for something so small and it takes time to adjust.
Mm.
Okay, that time what happens is when they do not validate from somebody, when you want that validation from somebody important that whatever I'm facing is true, that is gone. And then you start feeling so low about the fact that, oh, you're so sensitive, you're so weak. How are you going to handle something much more bigger than this? Or you're never going to do something like this. You're such a loser. And these thoughts just keep continuing and it goes into a vicious cycle.
Mm.
Right? A therapist or a psychiatrist, a psychologist, whoever, will help you understand whatever you're going through in a very non-judgmental, neutral way. So I'm not saying they're gonna give you validation, but they're all like going to present it to you the way it is, so that you
Mm.
understand that whatever you're going through is okay and you can handle or manage it. So,
Great, great.
I mean, to answer your question in first place, I think the major thing is to understand that it's treatable, it's manageable. So, seeking help is something the person should do in whichever way it's possible for them, or at least try it out. Like, if you're able to
Mm.
control it or manage it on your own, absolutely good, very good. But if you're not able to, there is nothing really wrong in seeking help. That just makes you more stronger and not weak.
Great. That was a very good in-depth answer, I guess. So, when it comes to solutions, I think for me personally, medications have helped me a lot.
Right.
I was on medications, you know that very well, but I was very scared to take it. When you told me to take medications, I was very scared to take it because I've been through this entire stigma, like don't take this medicine. I was questioning myself, what is there something really wrong with myself? I used to question this a lot. And I
Mm.
faced two, three incidents which I really want to share. Is that
Mm.
first when I remember you uh, told me to take this medicines and you helped me with, I was not sleeping. So you told me to take the sleeping tablets. Okay. And when I went to the medical shop, uh, it's I don't remember the exact. It's a very famous medical store. I went there, and that guy who saw me, and he was like, he started telling me like, why are you taking these medicines? I was like, I don't know. You know, My doctor has given it to me. She prescribed me. I obviously have to take it. And they were like, beside me, there were like almost 10, 15 people who were standing,
Mm.
like, from to the different counters. And he's started, saying, like, at this age, you're taking, you know, how you're going to face yourself in the future. And he started telling very weird things. I got very insecure about it. I told, man, can you please just do your job? Because I have to take it, and he gave, and he was like, stop taking it, it can ruin your health and all that thing. And I came into my room and started crying, I think it was very embarrassing, to be honest. Everyone
Yeah.
is thought like something is wrong with me. That is one incident. And secondly is, I faced it in my own friends group, is that some people, I had this one box where I keep all my medicines. You gave me like for 3 months or something, right? I have like whole cutta of medicines, so that I kept that box on my table, and somebody came and they saw it, and it was like, what all what are all this medication? I was like, I have a lot of anxiety issues. I take it every single day, and I was going on a and that night only I was going on a trip with my friends. Like
Right.
they were present, like almost 10, 15 people. And what happened was, this guy, at that day I forgot to take my medicines. I was in a very, excited and, very enthusiastic mind, I would say. I was very excited that day. I went out with my friends. In between, I had a panic attack. I don't
Mm.
know what happened. I started, my stomach kind of, it started to ache a little, and suddenly I was not able to breathe. I know it's an anxiety attack. I guessed it instantly. Suddenly, all those, something is going to happen to me. Something is going to happen to me. This comes, it. I feel like your body reacts like as if there's a lion in front of you and it's going to come and kill you. That exact feeling, you're very panicked completely. And I
Right.
told, just leave me alone. Just let me go to my home.
Mm.
And next day, when my friends got to know about it, that he forgot to take it medicine, one of my friends started mocking me very badly, and I didn't say anything to him. He was like, he kind of judged me a lot. Can you please take those medicines, or else something will happen to you? And he started laughing about it, and I felt very bad. I didn't say anything to him, but I
Mm.
felt very bad about it, and I left medicines. Stopped taking completely because of that. And I faced a lot of withdrawals with all that also. I have very ups and downs, but I understood that, why it's important, why it is not important. Can you just tell it in a very context of a mental health professionalist, that how medications play a big role, and how safe it is to people to take it when someone prescribes you, and what is the like how we should be analyzing it?
I mean, that's a good question. Um, so when you go visit a psychiatrist, they actually assess to what severity your symptoms are. Right. So not everything needs medications for sure, but medications obviously makes the course of treatment pretty much easier.
Hmm.
Right. So you were taking therapy, and I think it was 2 or 3 months into therapy when we thought that the severity was not coming down at all, and then we switched to medications plus therapy, right? So I think when you visit a psychiatrist and they assess how much is the severity, etc., if they feel like this is something that cannot be managed
Hmm.
by yourself, and it's very painful to have a panic attack, right? It's not
Exactly, it
really
is.
a very nice moment to be in. And it's not necessary that all the times non-pharmacological relaxation techniques work. They work, they absolutely work on a long-term basis. It's as similar as when you have a spasm in your back, right? So when you
Hmm.
suddenly wake up from sleep in the morning in a very bad way, or you have a bad pillow, you have like a very bad spasm in the neck, right? You're not able to turn at all.
Yeah.
Okay. And it's as similar as somebody coming and telling you, do yoga every day and you're going to be completely all right. It's because you don't exercise at all. That is the reason why it's happening.
Hmm.
Okay. But still, you're not able to move your neck. You can't do yoga at that particular moment, isn't it? Right?
True.
So it's the pain that needs to go down, and only then you can probably start doing yoga and prevent it later.
Hmm.
To relieve that spasm, what do? We either take a hot bag and keep it, or we take a medication. isn't it? So it's as simple as that. When a panic attack happens, when there is a lot of anxiety, when there's a lot of depression, with suicidal ideations or negative thoughts, excessive negative thoughts, right? So all of this happens because of neurochemical imbalance in your brain. It's not happening just haywire. ऐसे कुछ हम लोग we're not building castles in the air, right? It's actually happening. There is a hypothesis for it. There is scientific evidence for it. I mean, the hypothesis, whatever I told you about the neurochemical imbalance. The reason why medications work is because of that. So there is an imbalance. The medication takes care of that imbalance for now, so that you don't have to go through that entire painful symptoms that you have. Just
Hmm.
because we cannot see a panic attack, we cannot see how sad you are or how low
Hmm.
you feel, does not mean it does not exist. It exists, right? So it's just that you just cannot see it just the way how fever comes because of temperature, or like when you have kuch maar lagta hai and you're able to see blood and redness around it. Just because you cannot see something like that does not mean that medications are something that we are giving out of nothing, right? So it's going to make that process of healing much more easier because you will
Hmm.
not feel that kind of acute pain, emotional pain that is there. So once medications are given, it helps them relieve it and get back on their feet a little bit more faster than just going with lifestyle changes at that time. And not, it's not necessary that all the time there has to be a traumatic factor or there has to be a trigger or a stressor for anxiety or depression to occur, like we were talking about it before. Imagine endogenous depression, right? There is nothing wrong and still there is a chemical imbalance, right? So whom do you blame at that point of time? Nothing. You have to take medications at that point of time, get the imbalance back, and then go on with your life.
Hmm.
Right, and it has to be prescribed by a psychiatrist only. So
Okay.
seek a psychiatrist only for psychiatric medications, not anybody else. Okay. And there's a lot of stigma about psychiatric medication that they make you addicted. There might be a lot of withdrawal symptoms and they give you only sleeping pills. All of these are not true, right? So the medications that we give help you relax. I'm talking in terms of anxiety and depression. So they're basically medications which help you relax, and that relaxation causes sleep. It's just a part
Okay.
of it. Just causes sedation. They're not sleeping pills at all. So they help you sleep. They do not, and a psychiatrist will not prescribe you something that will cause addiction.
Hmm.
So even if they give you, let's say, benzodiazepines, which are normally used for sedation, sedation is sleeping. So if they
Hmm.
give you that as well, they will not give you more than 10 days or 15 days. And these medications are not available without prescription. You cannot buy them like how we buy Crocin or Dolo. You have to
Hmm.
go with a prescription to a pharmacist. There has to be a seal. There has to be the registration number, and only then you are given these medications. And the psychiatrist will take care to make sure that you do not depend on the medications solely.
Hmm.
Yeah. So it seek a psychiatrist properly. I mean, consult a psychiatrist properly to understand more about medications if it is needed or not. And normally, it is not given without properly assessing and understanding how your occupation is, how your social life is, etc. And
Hmm.
the whole myths that are there about how it can cause addiction and withdrawal, etc., can be clarified by asking somebody who has an expertise in it, right? So
Hmm.
just think of it like relieving that particular spasm for now so that you can go on with your day and then think about a lifestyle change which is going to be there later.
Hmm. Okay, that was very nice explanation about this, because I think that this stigma around medications is very much, like, especially maybe in India, I don't know. I kind of feel it's a lot
Oh no,
in
it's
our
nothing
country.
like that actually. It's just there everywhere. I mean, psychiatry is a very new thing anywhere for that matter. It's just
Okay.
that some people are pretty open about it, some people are not. But I have seen a changing curve. Like even with medications for that matter, people
Hmm.
are accepting it. They are coming to us, and it's not just the urban youth that is there. I have seen a lot of. I've worked in rural places. And I have seen a lot of them coming and seeking help, and they do not hesitate.
So this is the part 1, and I hope you enjoyed this part 1. We will be posting the part 2 very soon, or maybe it would have been posted while you're listening to this. So keep streaming, keep watching the Akshay GP Show for more such content.